Gigo mitima miyo wang'e ni Nyasaye maduong' ni Nyasaye gigo mitima.
The condition is common in developing countries, including Kenya. It's very difficult to know how many patients are suffering from fistula, but every year we get about 3,000 to 7,000. The nurses actually are very important in patient care. Situations where the nurses have not had good training, breakdowns are common and the success rates are actually low. But in our setting here, we have given our nurses a lot of intensive training.
Sana. Pole.
Obstetric fistula in our setting is actually as a result of difficult labor, prolonged, difficult, obstructed labor. Mama is in the village, she's in labor, she can't get to the hospital because the hospitals are very far apart. So she stays in home for days and days, difficult labor. Finally, what happens, the head of the baby sticks in the pelvic region, compressing the bladder, compressing the rectum. At the end of the day, blood supply is cut off, so the patient gets tissue damage around the bladder area and the rectum area. The consequences, 2, 3, 4 days later, patient is leaking urine and stool. That's what causes obstetric fistula.
Nimekaa miaka 16 nayo. Watu hawanipendi juu sasa kila mtu akikuona tu anasema huyu sasa ako na hii shida ya mkojo, hata ukimumsia kama ni vitu na uko nazo za kuuza, mtu tu anakumwagia mate tu.
These are women who come here with a lot of problems. They have challenges outside Kainaka.
They just stay at home. They don't go to church. They don't socialize. They don't go to market. When they want to go, they are told, "You people, what happened with you? Why are you having a problem with urine? It seems it's a bad omen to this community. How did you get a fistula and other women are delivering normally? Why you? Why not her?"
When they come here, you just treat them with respect, dignity. Put yourself in that shoes of that patient.
Nursing care is critical in terms of giving them hope and encouragement so that they feel part of family and their healing process is actually speeded up with that kind of environment.
In groups, they share their experience. They say, "I have this fistula," others say, "I have this, I've been having this." They speak out their problems so that they don't feel that they are stigmatized.
Jacqueline had a very complicated fistula actually due to obstructed labor. That's about 18 years ago, I guess.
Sasa leo nimekuja kuelezea siku umeambia unaenda theater leo. You make yourself your language clear. You try to use as much to explain so that you can understand what you are going to do.
Ila kitu nimeona inaweza kunifanya maisha yangu, itaifanya maisha yangu ibadilike na hiyo matibabu. Najipea moyo juu wenye nilipata huku wametibiwa na wamepona na wameenda nyumbani. Hata mimi najipea roho.
In the morning, we take the vital signs, that's blood pressure, pulse. Then we explain to the patient what is going to be done there in theater. She gives her consent, then we will the theater.
Juu nilifika huko theater, wakanidueka shindano. Ni si kulala ya kunigandisa tu hapa mguu, lakini nilikuwa naona daktari tu vile anaendelea kazi huku. Na wengine wakiwa huko si ukuwa naona, lakini kuna mwenye tu tulikuwa naye amesimama side akiniongelesha. Si ukuwa na uoga yoyote.
After surgery, A patient comes with a urine bag, with a catheter from theatre.
Most of the time, the nurses have been advised on how to monitor the flow of urine so that there's no kinking and the drinking water to make the urine less concentrated and blockage is reduced by the amount of liquid these patients are taking. The catheter can block, and at that point we do what we call flushing of the catheter, and occasionally we are forced to change the catheter.
Sometimes what tells you to suspect that the catheter is blocked, the bed might be wet. That means the urine is not going to the urine bag. If the urine is not drained, you flush the catheter using normal saline, use a syringe, then you flush if there is some debris that might have caused the catheter to block.
The nurse is not able to flush it well, he or she is supposed to call the doctor quickly to either change the catheter or help in flushing of the catheter.
Vile walinimalizia hiyo operation, saa hii ninaendelea na hiyo catheter, walinaendelea tu mzuri, sina shida yoyote.
When checking for infection, you can take vital signs. For example, temperature. If there is high temperature, that's fevers, that may tell you that the patient is having infection. Some may have some discharge, like pus, so you may suspect there is sepsis. Then you do lab work. After doing the lab work, the white blood cells may be high. That you may suspect there is infection.
In some scenarios, of course, they get a bit of wound sepsis. Postoperative sepsis is a bacterial infection still, actually. It's infection of the operated wound site. The common is actually bacterial infections, most likely Staphylococcus aureus. Some have malaria, actually. Malaria is very common around this region.
If you suspect there is infection, you give the prescribed drugs, for example, antibiotics. You keep the patient close to where you can observe, so that you can attend easily. And you just explain to them what has happened. You reassure the patient and you tell her that I have informed the surgeon. After surgery, we give them some sanitary pads every morning. If it's fully soaked, you know there's a problem. Observation of vital signs also helps us to know if the patient is bleeding. If there is low blood pressure, you know there's something. Eye pulse rate, during physical examination, you can observe the eye. If it's pale, the patient is bleeding.
A nurse is supposed to be like monitoring of vital signs, blood pressure. So a nurse is really critical in terms of care of this patient and a link between the patient and the doctor in terms of managing complications.
One, two, three. Matibabu nikapata kutoka kwa James. Naona naendelea mzuri. Juu tangu nifanyiwe operation, naendelea mzuri kabisa, sina shida yoyote.
Once these patients are treated and you see them going home, they are dry, they are not leaking, they have no stool incontinence, I personally feel good.
At the end of the day, I pray that we don't have many fistulas in the future, like developed countries that actually fistula was eradicated almost 100 years ago. I believe we might get there once maternal care is improved.
wenye sasa walikuwa wamenikataa, sasa ni kama watanikaribia juu sasa hiyo shida yenye nilikuwa nayo, aibu yenye nilikuwa nayo, hata mimi hata nilikuwa nakopa kwenda kanisani imeisha. Sasa nitaenda kanisani. Mbuya Nyasaye, mbuya Nyasaye, mbuya mono, mbuya mono, mbuya Nyasaye, mbuya mono, mbuya mono, mbuya Nyasaye. Omonene nakumire ningorabe bunaye, omonene nakumire ningorabe